Greetings, dear friends. Today I'll be talking to you about heart failure. It's a dangerous epidemic which is hitting India, and you'll be aware that heart failure deaths, mortalities are much more than cancers. Like breast cancer is only 11%, Hodgkin's lymphoma is 15% mortality, non Hodgkin's lymphoma is 31%, colon and rectal cancer is 35%, leukemia is 43%, and heart failure, my dear friends, has a 48% mortality. So we are looking and we are staring at a global epidemic, and this epidemic has hit India. Now, when we look at the heart failure as a condition, it's a progressive condition, and as I said, it has a high mortality rate. There's a chronic decline in the expected life expectancy when each episode of heart failure occurs and each episode of hospitalization occurs due to heart failure. So, over a period of time, this disease is a killer and it's wiping out the younger population in India. When you look at the risk for cardiovascular deaths or heart failure hospitalization, there's a 50% event rate when you have a heart failure patient after the index admission at 5 years. So, if you look at a patient who's having an average age of 55 years with heart failure and treated only with ACE inhibitors or beta blockers, you'll find the mortality rate increases dramatically. But if you're able to add quadruple therapy, ACE inhibitors, beta blockers, MRAs, as well as SGLT2 inhibitors, you will add 8 years of life to this 55-year-old individual. And this 8 year of life will be free of cardiovascular death or heart failure hospitalization. So when you want to convince a patient that why are we giving polypharmacy for heart failure, this is how you need to convince that we can add 8 years of event free life to you. So, when you look at heart failure patients who are at very high risk of death and hospitalization, you'll find that 9 out of 10 patients are symptomatic even with the current heart failure standard of care. Nearly one third of these patients with heart failure with reduced ejection fraction are at high risk of hospitalization and cardiovascular death, including those who appear stable. There is nothing like stable heart failure. We have to treat all of them as if they're going to have an impending hospitalization and also monitor them very, very carefully. And also, we need to understand that each hospitalization for heart failure increases the mortality rate. So, in the first year of hospitalization to heart failure, there is a mortality rate of 2.6. After the second heart failure hospitalization, the mean survival is only 1.8 years. After the third heart failure hospitalization, the mean survival is 1.5 years. And after the fourth hospitalization, it's only 1.3 years. And following which, at any time, there could be death or mortality of the patient.